Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Michele Kimber, a registered nurse and a certified diabetes education specialist who's been with NorthPoint since 2004. Michele has been a nurse for more than 20 years and started out at NorthPoint as a triage nurse and a nurse visit before working towards getting certification to be a diabetes education specialist. And we have Michele joining us today. Welcome, Michele. Thank you for joining us to talk about National Diabetes Month and to answer our questions.
Yes.
All right, let's dive right in. So, like I said, Michele, you are a certified diabetes education specialist. So, our questions are going to be pretty general about diabetes. I think it's something that a lot of people have heard about but don't exactly know the details about. So we'd like to know from your expertise. Right away, can you give us a definition of what diabetes is?
Okay. Diabetes is a chronic disease. It doesn't go away, but you can manage it. When you have diabetes, your pancreas make little or no insulin,
Mm-hmm.
or the insulin you have is not working the way it should. Either way, sugar cannot enter your body cells. Instead of entering the cell, it stays trapped in the bloodstream, raising the amount of sugar in your blood to abnormally high level. Because your body is not getting the sugar it needs, you are likely feel tired. You may urinate more often than usual. You may be very thirsty.
Okay, thank you.
Mhm.
Can you give us the difference between type 1 and type 2 diabetes?
Sure. Type 1 diabetes often occurs in children or adolescents, but adults can develop it as well. About 5 to 10% of all people with diabetes have type 1 diabetes. It is believed that there may be a family history with type
Mm-hmm.
1, environmental factor, and the body immune system may mistakenly destroy the beta cells in the pancreas, which produce insulin.
Mm-hmm.
Beta cells are special cells in the pancreas. Beta cells detect the rising blood glucose level. Type 2 diabetes, the pancreas may make insulin, but the body does not use the insulin properly. About 90 to 95% of all people with type 2 diabetes, many people who develop type 2 may have a family member who has had type 2 diabetes. Another factor in the developmental of type 2 is weight gain. Excess weight gain, especially in the abdominal belly region, can cause insulin resistance. Insulin resistance, sometimes referred to as impaired glucose tolerance or metabolic syndrome. Metabolic syndrome includes elevated blood pressure, elevated blood glucose, excess body fat around the waist, abnormal cholesterol levels. And also, I will talk about insulin resistance. Insulin resistance can occur as a result of genetic factors,
Mm-hmm.
unhealthy lifestyle choices, or both. Most individuals who have insulin resistance will eventually develop diabetes. And also, some of the metabolic syndrome can be diabetes, heart disease, stroke, physical inactivity, being overweight, family history of heart disease, and also elevated blood pressure.
Thank you.
You.
Can you tell us about A1C? What is A1C?
Mhm. A1C tests reflect show an estimate average glucose over the past 3 months. These blood tests let your healthcare provider see how well your diabetes is controlled over a period of time. A normal level of A1C for someone without diabetes is less than 5.7%. Pre-diabetes range from 5.7 to 6.4%, and diabetes range 6.5 or higher. So if you have a A1C 6.5% or higher, that means you
Mhm.
are diagnosed with diabetes.
Okay. Let's talk about prevention. How would you recommend um, someone prevent getting diabetes?
The best way to prevent type 2 diabetes is by adding physical activity, creating a healthy food patterns, and following up at your primary care for annual screening. Annual screening is very important.
Absolutely.
Mhm.
And what signs and symptoms of diabetes can you tell us about?
Yeah. Some of the signs of symptom of diabetes, if you are going to the bathroom more often, you feel thirsty all the time, you're drinking a lot of fluids, you're feeling very tired and weak, and have an increase of appetite, you're eating a lot of food at one time, blur vision, sore that's slow to heal, bladder or vaginal infection, or feeling irritable, moody, or depressed. And some people also can have some weight loss. In some cases, there may be no symptom at all.
Mhm.
That's why annual screening is very important, especially if you have a family history with diabetes.
Absolutely. And then moving on to treatment, how would one go about treating a
Mhm.
diagnosis of diabetes?
Yeah. Your treatment plan is likely to involve monitoring, checking your blood sugar, exercising regularly, following a meal plan, controlling your weight, and also taking medication if needed, and managing stress, because stress can increase blood sugar level, especially during COVID. It's very important that you test your blood sugar just to make sure it's under control, because stress, a lot of food, lack of activity can increase the blood sugar level. Thank you.
And then moving on from treatment, uh, could someone be cured of their diabetes diagnosis? Is that possible?
Unfortunately, there are no cure for diabetes, but thankful we have resources to help us keep diabetes well controlled, such as glucose meter, check your blood sugar, know your numbers. Continuous glucose monitoring system called CGMS can monitor your blood sugar level. The Dexcom G6, as always, follow your doctor recommendation. Your doctor recommendation is very important. So follow annual screening, talk to your doctor about different options for you.
Okay, thank you. Um, and so, just to clarify, if someone was to get diagnosed with diabetes and they were able to control their levels, you would say that that person is managing their diabetes, but they are not treated from it. Is that correct to
Yes,
assume?
yes. You
Okay,
always manage your diabetes. It
sure.
cannot be cured. As long as you have diabetes, you have it for life. You manage
Okay,
it and you try to control it the best way that you can. And
okay.
of course, with our help.
Right, right.
Mhm, mhm,
And that ties into my next question
mhm,
about blood sugar level. So,
mhm.
why is it important if you are diabetic to keep your blood sugar levels low?
Yeah. It, the best way to keep your blood sugar level under control is, why is it important? It's important
Yeah.
because it prevent or delay complication of kidney disease,
Hmm.
eye problem, heart attack, stroke, poor circulation in lower limb, infection or vaginal infection.
Okay, so tell us about blood sugar level
Mhm.
ranges and why
Okay.
it's important to
Mhm.
look out for those.
Sure. The American Diabetes Association recommendation for many non-pregnant adults with diabetes, the goal before you eat, the goal is to check your blood sugar for
Hmm.
fasting reading. It's between 80 to less than 130. Okay.
Okay.
Um, and in 2 hours after the meal, less than 180 milligram. So
Hmm.
if for some reason that your blood sugar 2 hours after a meal is 200,
Hmm.
you can ask yourself, okay, did I have too much to eat? It's always good to keep a meal log to see how much you're eating and how much you're consuming. We want you to drink more water, okay? And then also, if you're gonna have any kind of fruits, eat the fruit, don't drink the juice. It's better to have, uh, um, small apple, small orange, small banana instead of drinking the juice. So that's
Sure.
our recommendation. And if you need more information, you can also uh, text our dietitian. Okay. And also, I'm
Okay.
gonna go over high blood sugar to show you the difference. Why is it important
Sure.
that you only drink juice? Okay. So if your blood sugar is greater than 180, that's mean you have high blood sugar level. Okay. And then high blood sugar level, some of the symptom is, if you see that you are going to the bathroom more frequently,
Hmm.
feeling very thirsty,
Hmm.
blur vision, you have trouble concentrating, you're feeling very irritable, or you have a headache, those are signs of high blood sugar. The treatment for high blood sugar is follow your meal plan as closely as you can, take your medication, drink water, at least 8 ounces every hour, and check your blood sugar every 2 to 4 hours to make sure it's coming down. Okay?
Okay.
Low blood sugar, anything less than 70 can be an emergency.
Hmm.
Some of the sign of symptom of low blood sugar: shakiness, weakness, sweating, dizziness, headache. Some of the severe symptom, people can have a seizure or coma. So that's why we asking you to monitor your blood sugar closely if you are taking insulin, so you
Hmm.
don't have a low blood sugar. Anything less than 70 need to be treated with 1 cup of milk, if you drink milk, if you're not lactose intolerant, or half cup of orange juice, apple juice, any kind of fruit juices. That's why we do not recommend the juices if you have diabetes. We want you
Hmm.
to eat the fruits.
Hmm.
Okay. So, and then also, if you do not feel better in 15 minutes, we
Hmm.
check your blood sugar. Okay. If you do not improve after taking your second a treatment, like another half cup of orange juice or whole cup of milk,
Hmm.
it's okay to call 911. Two
Okay.
blood sugar treatment, nothing happened, the sugar is not going up, it's okay to call 911, because a low blood sugar is an emergency if it's not
Hmm.
treated. Okay.
Hmm. Sure.
You might be, uh, some people have a glucagon, they can just
Hmm.
take the glucagon shot and they're okay, but not
Hmm.
everyone is qualified to get that, I
Sure.
believe. Okay.
Okay.
And then once your blood sugar is above 80, if it's your next meal, it's more than 1 hour away, you should eat
Hmm.
a snack which contain at least 15 grams of carbohydrates.
Hmm.
Always, always carry some form of fast acting sugar with you, maybe three
Hmm.
to five glucose tablet,
Okay.
or three or four, 5 piece of candy and chew it really quickly and swallow that. And that can also help you. Always
Sure.
have something in your glove compartment for emergency use only,
For the low blood
for
sugar
the low blood
people.
sugar. Hmm.
Sure.
Yeah.
Makes sense. I've
Hmm.
heard that before. Yeah.
Yes.
Yeah.
Yeah.
Okay. Thank you. Thank you for
Hmm.
clarifying.
Yeah.
And then you've referred to this a little bit before in your answers, but what type of diet do you recommend for someone living with a diabetes diagnosis?
Okay. The word diet can have so many definitions. So we like to use the word healthy eating patterns. What matters the most is how much and how often you are eating the food you enjoy. If people are not sure where to start, go online, choose myplate.gov. The DASH eating diet is a very good way to start, and also Mediterranean diet. Okay.
Okay, thank you.
Mhm.
And then maybe give us that recommendation one more time
Mhm.
online. Where should people check that out?
Okay. The choosemyplate.gov,
Okay,
the DASH diet, and
okay,
also the Mediterranean diet,
sure.
especially if you're trying to lose weight. The
Okay,
Mediterranean diet for heart, it's good, very good.
that's what I've heard.
Mhm.
Um, and this also, again, leads into my next question.
Mhm.
So, what resources are out there to help people manage their diabetes?
Yeah. The American Diabetic Association and the American Heart Association are great,
Mhm.
easy to read online resources available to the public with those two sites. They're very nice, very easy to read. People understand them better. Okay.
Absolutely, thank you.
Mhm.
Um, So maybe let's talk about what you've seen or experienced, or maybe what some studies have shown about diabetes and who it affects the most.
Okay.
So, how would you say diabetes disproportionately affects racial and ethnic minorities?
Diabetes can affect anyone. However, the highest risk minority group are Native Americans, African Americans, Latino, Asian American, and Pacific Islanders. That's why it is important to follow up with your primary care provider annually for screening, so we identify these risks and take action early on.
Um, Talk about NorthPoint. What services do we offer for diabetes management?
We have me as a certified diabetes educator,
Hmm.
as well as a registered dietitian.
Hmm.
Now we have two of them,
Hmm.
as well as a PharmD. They help with
Hmm.
medication management,
Hmm.
as well as your primary care provider. We all work together as a team to help the community manage the diabetes.
Um, you talked about insulin a little bit too. I
Mhm.
understand that insulin is one of those medications where people are known to be rationing it.
Mhm.
Can you speak to that? I know you said, contact NorthPoint if
Mhm.
you have coverage issues.
Mhm.
Our services allow for us to um, have folks be treated for free.
Mhm.
Um, So, can you speak to what your experience has been with people um, who are facing those kind of financial issues with their health?
Mhm. Sometimes people forget that they have a refill, or sometimes
Hmm.
people forget that they have a resource that can help them.
Hmm.
We have those financial aid ready to help them
Hmm.
get some sliding scale for
Sure.
little of nothing, and then also be be an advocate for yourself.
Hmm.
We are here also to support you, but be an
Hmm.
advocate. Call us, find out how we can get a refill because we do not have insurance, or we don't have a way to get insurance, or any kind of problem with your
Hmm.
health. Your blood pressure is high. You can
Hmm.
call us so we can get you a prescription. And then now we're giving free blood pressure kit to
Mhm.
monitor your blood pressure at home for
Mhm.
home use. Okay, so so we have different. Oh, we also have um, a health coach. I forgot to
Mhm.
mention one of my.
Yeah.
We also have a health coach that can also assist you, calling you on a weekly basis to check your blood pressure to
Mhm.
see, what's going on. If it's elevated, getting you scheduled with the dietitian, and then also getting you an appointment with your primary care provider.
Okay, good to know. And I'll have that information pulled up, our number and our website here at the bottom
Sure.
for folks if they're interested in our services around diabetes
Mhm.
management. And we certainly have more time. If there's anything that we didn't cover, what would you like folks listening to know?
Okay. How type 1 and type 2 difference? The difference
Yeah,
is
absolutely.
people wish type 1 diabetes will always be on insulin. Since the body do not make any insulin at all,
Mhm.
they are insulin dependent diabetes. So do
Mhm.
not go without your without your insulin.
Mhm.
Do not go without your insulin. If you have
Mhm.
any problem, please call us. We can help you get coverage, and we
Mhm.
also can help you get your insulin, get your medication.
Mhm.
Okay. People with type 2 diabetes may need to make lifestyle changes to control their blood
Mhm.
sugar level, and they may also need to take all diabetic medication along with making lifestyle changes to control their diabetes by
Mhm.
going for a walk 30 minutes, see
Mhm.
our dietitian, also
Mhm.
see our PharmD.
Okay. Thank you. But I would like to know maybe a little bit on the topic of COVID, what you've seen. We talk about COVID is making people prioritize certain health services. So, have you seen COVID affect how people manage their diabetes?
Yes, yes, yes.
Okay. How so?
People have a lot of elevated blood sugar.
Mm-hmm.
I've been seeing more than ever.
Mm-hmm.
Lots of elevated A1C levels.
Mm-hmm.
I believe people just stay home, they're not moving,
Right.
no activities. I really recommend that people have a plan, and we can help
Mm-hmm.
you with that.
Yeah.
Have a plan, your exercise, your diet, or your meal plan.
Mm-hmm.
We go by meal plan. Manage
Right.
your portion, how much food you're consuming at one time.
Mm-hmm.
Okay, drink a lot of water and get up and move around every time you watch TV. Get up, move around every
Mm-hmm.
commercial. Okay. Also, follow up with us. We can talk to you over the phone, make some
Mm-hmm.
changes over this phone, adjust
Mm-hmm.
your medication over the phone. So
Mm-hmm.
we are here for you. We are here to help you. So
Absolutely.
yes, so anytime, just call. I'm at NorthPoint 5 days a week. I'm here to assist the community to make better lifestyle changes. And
Go for it. Yeah.
I have one more takeaway. No
Yeah.
matter
Absolutely.
which type of diabetes you have,
Mm-hmm.
your goal is to control your blood sugar
Mm-hmm.
by making lifestyle changes that will help improve your blood sugar and also improve your health.
Absolutely. Thank you. Thank you for listening to NorthPoint Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors,